So a colleague and I, Neil Burkle, and some of our patients decided to do something about the problem of very little rare disease research going on, particularly for ultra-rare or undiagnosed diseases. We also saw a problem that if a clinician or a parent even had a really astute idea about how to fix a condition, there was no way to push that forward. And so we co-founded the Rare Disease Foundation and developed a microgrant program whereby people can apply for small grants, $3,500, that are good for a year, that specifically focus on a rare disease and will improve patient care. So they're really targeted at the front lines of patient care, and they operate under the theory that research is care for people with really rare diseases, because you just don't know how to care for them properly without doing some research. And so we've started this program in 2009, and currently we're funding 6 countries around the world, and we're hoping to expand further afield. So it's been popular. We've given out about 300 so far, and there's been several potential treatments for diseases, 9 diseases uncovered through this program, over 20 disease genes found, a host of new clinical algorithms developed, and most importantly, hope for patients with rare diseases or undiagnosed diseases through the program. Yeah, we operate under a big tent philosophy, so any kind of care improvement qualifies for that. So it could be an N-of-1 drug trial. It could be an outcome study to say, for this very small group of rare disease patients, what of the interventions that were tried, which ones worked better and which ones worked less well. And so we can then tailor care a little bit better as a result of that. It can be simply, how do you elicit the patient's belief about how well a drug worked for them in a trial? And there's very little research around that area, and we're actively funding that area because we believe that kind of really focused qualitative research that focuses on the patient experience is very important for future drug trials. So one early microgrant we had, they applied for money to pay a librarian to do a literature search. And I was like, that's not really good use of our money. And the parents were like, no, doctors are busy. They should have the right to do that. This is a good project. And the project was, how many treatable causes of intellectual disability are there? We all thought, maybe a couple dozen, maybe 3 dozen. Well, with a systematic literature review, they found 65 or 75 of them, and then they developed a testing algorithm so that you would never again miss a child with a treatable cause of intellectual disability. Their next grant was $2.25 million. They built an app, and they've now led to the revision of guidelines worldwide about how you work up intellectual disability in the clinic. So that's one of our greatest hits in a way, and we're really happy that we have several stories like that that are leading to changes in a more broader scale than you would expect from this little peanut of a grant. Microgrants are designed for busy clinicians like myself who don't have time to put out 25 pages and wait 9 months. So they are 1 page, half of it's a lay summary, half of it's a scientific summary. We give you the answer back in 15 business days. We have competitions 4 times a year. And the review panel consists of scientists, doctors, parents, patients, and people with ethics experience, usually 5 reviewers per microgrant. And we average all the scores because we want the patient voice to shape the research funding priorities as much as the scientific and medical voice funds the priorities. And so people love it because all these little ideas that they have, you know what? I saw this child doing this, and I wonder if this might work for this disease. That idea now has a way to go forward. And it's an immediate way, and it's easy, and it's short, and we keep our funding levels fairly high because I hate wasting time applying for grants endlessly. And so this program is kept at a level where people aren't wasting their time.